Senator Fazio.
Good afternoon, Madam President. This is, in fact, my first time speaking to this body, and it is a great honor to join my new colleagues and also to represent the good people of Greenwich, Stamford, and New Canaan, Connecticut here in the Senate. I rise today in opposition of the resolution and in support of the restoration of the proper rights and role of this body in our constitutional structure. This debate today is not primarily a debate about the underlying policy decisions, but rather a debate about the rule of law and the checks and balances that are rightfully built into our system. We've come a long way in this pandemic in the past year and a half, and we are deeply grateful to so many people who have risked so much and worked so hard in order to keep us safe, especially frontline workers and healthcare workers who have worked very hard to deliver healthcare in very difficult times. I'm also appreciative of leaders on both sides of the aisle for the hard work that they put in very uncertain times, especially at the beginning of this pandemic. I believe that the public rightfully accorded our government and our leaders a lot of grace, especially at the beginning of the pandemic. And in fact, for my part, I would like to commend many of the actions and initiatives of our governor and his administration, especially to keep schools open throughout the pandemic and ensure that our kids are educated in difficult times. Also, some high-quality reductions in regulations that ensured the delivery of goods, the creation of jobs, and access to health care when those regulations would otherwise inhibit the delivery of those things. However, we're at a very different point now in time than we were 16 months ago when there was so much uncertainty and so much ignorance about what this novel disease actually entailed. In fact, today, Connecticut can brag having the lowest infection rate of any state in the country. It can also boast of having the highest vaccination rate of any state in the country, a full 80% of adults as of today in this state vaccinated. That is a good position to be in, and in fact, it was the marker across the aisle from Republicans and Democrats of a threshold that needs to be met in order to roll back some of the emergency powers of our government. So now that it has been met, we have to ask ourselves why we continue to be in the unusual and super constitutional position that our government is currently in. Connecticut residents have openly chosen the ability to protect themselves through vaccination or social distancing. They're conscientious. They made that choice voluntarily, not through force. And in fact, there's a lot of evidence that that is exactly what is reducing infection rates and keeping people safe. The CDC, in a recent study, said that there is an 86% decrease in the likelihood of hospitalization for those that are vaccinated, even against Delta. So I commend the open choices that many Connecticut residents have made. And I also emphasize the fact that persuasion is the most powerful tool in keeping people safe, rather than force and compulsion. So statewide mandates are, shall we say, in many cases, counterproductive. But again, we're at a very different place today than we once were. And so it is entirely reasonable for this body to want to reassert itself in its typical constitutional role to make policy, in fact, to initiate policy in our government. That is the proper way forward. And I also must commend and give my appreciation for the 10 Democrats in the State House who crossed party lines in order to articulate that very view as well. And I hope to see a bipartisan vote against the resolution today in addition. But for those who are delicately considering both sides of this issue, I think there's a couple of questions that we can ask ourselves and our voters. First, until what point should we permit the exercise of these special executive powers? What is the logical conclusion of a sixth extension today? Is it that vaccinations need to be a point higher or 2 points higher? They're already the highest rate in the country. Is it that our infection rate should be the lowest in the country? Well, it already is. Should it be 17 months, 18 months, 19 months? If we maintain and extend for another 5 months these executive powers, in fact, to 2 years past the point that we originally vested them in the governor, then we have to ask ourselves, is this really an emergency operating procedure? Or has this become the standard operating procedure of our government? In that case, it would strike me that it would be a violation of our basic constitutional structure of government and checks and balances. So the second question we should ask ourselves is, what if the shoe was on the other foot? What if there was a governor and a government of a different party who wanted to assert emergency executive powers for the governor to combat rising crime in this state? COVID is a horrible and dangerous disease that has taken the lives of far too many adults, especially older adults. But rising violence and crime is stealing the lives of far too many young Connecticut residents today. In the past year, in 2020 alone, 113 Connecticut residents under the age of 40 were killed in homicides, were murdered. 60 in the past year and a half died of COVID under the age of 40. So by that measure, if we're willing to abrogate constitutional checks and balances to protect the lives of the young from disease, then why wouldn't a governor also be willing to do that for crime? To change legislation, to change the law unilaterally in order to protect the public safety. Connecticut also faces an economic and jobs crisis. We have the 4th highest unemployment rate in the country, and we have one of the lowest rates of economic growth in the country over a long period of time. What if a governor of the other party asserted emergency executive powers in economic crisis in order to cut taxes and spending? Heaven forbid that were to happen. The outcry would be enormous. And yet 2 years after the beginning of a horrible crisis, given, when the state legislature is perfectly willing to meet in emergency sessions for any other number of reasons, we're unwilling to assert our constitutional prerogatives as the lawmaking body of this state. I'm new here, but I do understand that the old State House about a mile down the road, which opened in the 18th century, housed all 3 branches of government, offices of all 3 branches of government, and was designed in a very specific way, such that the state legislature was housed on the 2nd floor of the building, and the executive branch was housed on the 1st floor. It was done so intentionally to recognize the fact that the state legislature is superordinate to the other branches of government because it is the government, the branch of government that is closest to the people. We have co-equal branches of government, both in our federal and state democracy. However, the legislative branch is always understood in this country as the first among co-equal branches because it is closest to the people. It is the first article of the federal Constitution, and it is the article in the Connecticut Constitution that comes before the articles outlining the powers of the executive and judicial branches. All the underlying policy matters, the very important and difficult policy matters regarding public health that are being discussed today can be voted up and down by this body and should be voted up and down by this body. Our public wants compromise and deliberation. That's how they run their towns and their communities, by bringing people together to make difficult decisions. This body exists with its constitutional powers, not for the easy issues, but for the hard issues specifically. So my one last point I'd like to make is that the voters in my district and I think people across this country, are concerned about political division, are concerned about our communities and our country becoming more polarized, and tearing each other apart? Well, I think when we alienate the general public, regular voters, even ones in the political minority, from the governing decisions of the day, especially on important issues, we're only going to exacerbate that sense of alienation and the sense of division in our country. So let's reject this resolution today in order to reassert the just constitutional powers of this august legislative body and try to bring people together in order to protect the public health and make the future brighter for our entire state. Thank you.
Thank you, Senator. Will you remark